Hi, I'm Dr. Jyoti Patel. Today's topic is migraine headaches. For those of you who don't know me, I practice internal medicine and pediatrics and integrative medicine. And my intention is to provide you with health information so that you can have an open conversation with your healthcare provider and take back control of your health. So 38 million people have headaches and migraines in the United States. 90% of all headaches are tension or migraine headaches. Women are 3 times likely to have headaches than men, and 10% of children actually report having migraine headaches. So it's an important health topic and is one of the most common things that we see in our primary care practice. So when you go to see your doctor, they might recommend an over-the-counter Tylenol, Excedrin, or ibuprofen when you have a migraine headache. They might prescribe you a prescription medication like Imitrex or a triptan. And if you have a lot of headaches, they might suggest you take prophylaxis or regular medication to prevent headaches, like blood pressure medications, beta blockers, calcium channel blockers. They might give you antidepressants or seizure medications. Well, today I'm going to talk about natural alternatives for prevention and treatment of migraines. First thing I always ask my patients to do is keep a headache diary. Why? Because you are a unique individual. You live in your own environment with your own triggers, with people, with work, with food, with nutrition, with environment. Everything is unique to you. And writing things down can help us figure out if there's anything in your environment that might be a stimulus for your migraine headaches. So I ask my patients first to log their nutrition habits. Writing down what you eat can help us find potential food triggers. I sometimes will ask my patients to consider an elimination diet. If you're interested in elimination diets, I did a video previously on it. Please feel free to watch that. Now, what are some of the common food triggers? Alcohol, wine, cheese, nitrates in processed meats, MSG, like in Chinese food, artificial sweeteners, like in Diet Coke and Diet sodas and diet food. And so write things down. Not only do foods sometimes trigger a migraine, but lack of food, hypoglycemia, low blood sugar can also be a trigger for some patients and migraines. So be mindful about that. Also, dehydration, not having enough fluids throughout the day can be an easy trigger for a migraine, especially in the summer months when people are outside, they're poolside, or they're by the lake, they're drinking alcohol, or they're drinking sugary beverages or caffeinated beverages. They can dehydrate very quickly, and this can lead to a migraine headache. So make sure you're well hydrated, you're eating regularly, and you're keeping a food log so you know if there are any potential triggers. Second is stress. Stress is the #1 reported trigger for migraine headaches. So I ask my patients to work on resiliency. You can't remove stress from your life, but you can try to improve your coping mechanisms so you become self-reliant, so you learn how to mitigate your pain, so you can actually not propagate it further by feeding into it. Now, these techniques can include breath work, which I've done several treatments here on videos for you, meditation techniques, relaxation techniques. You could work with a therapist, with cognitive behavioral therapists or biofeedback. You can work with a chiropractor with craniosacral therapy. Also, there's a lot of reflexology points on your feet. So you can work with a reflexologist to learn how you can take back control of your headaches by putting pressure on certain points. You can seek the counsel of an acupuncturist. So using ancillary therapists to help you become more resilient and helping you with coping and stress management can help prevent migraine headaches. Next is sleep. Sleep is paramount for migraine prevention. Most of you that suffer from migraines can probably agree with me that if you don't get a good night's sleep, inevitably you'll have a migraine. So getting to bed on time, turning off your technology, doing something relaxing like meditation or breath work, taking a warm bath or a shower, giving yourself a self-massage with some essential oils, getting a good book, reading and listening to some music before bed as opposed to television or social media, okay? And then exercise. Now here's the problem. Some people overtrain, and overtraining can actually lead to migraine headaches. So if you are doing a lot of intensive exercises and you're finding yourself popping a lot of ibuprofen for your migraine headaches, cut back. try to do Tai Chi or Qigong or yoga instead. Incorporate a stretch program. See if that helps decrease the frequency of your headaches. So in addition to nutrition, stress reduction, sleep, and exercise, I sometimes will recommend supplements. So what are some of the evidence-based supplements that can help prevent migraines? Well, the first one is Butterbur. You may have heard of it. It's actually a level 1 or level A recommendation by the American Academy of Neurology and the American Headache Society for prevention of headaches. So anywhere from 50 to 150 milligrams a day, but before taking any supplement, please always talk to your doctor. Also, very important with Butterbur, make sure that it's alkaloid free. It has a product in it that can be carcinogenic or liver toxic. So you want to get a product that is guaranteed and standardized without these alkaloids. One of the products that has been highly recommended by the German Commission is something called Pentalax, and I'm going to spell it for you. It's P-E-T-A-D-O-L-E-X. And that's actually Butterbur that has been standardized and is pure of those alkaloids. Second is magnesium. Interestingly enough, it has been shown to be helpful in periods, so menstrual migraines. And it's a level B recommendation by the American Academy of Neurology and the American Headache Society. And taking about 500 milligrams of magnesium daily can help prevent migraines. Now, if you suffer from diarrhea from magnesium, you may want to try magnesium glycinate. It's a compound that's less likely to cause diarrhea. Third is riboflavin, vitamin B2. So vitamin B deficiencies are rampant in the United States. And remember that vitamin Bs are essential for neurotransmitter development like serotonin and dopamine and norepinephrine, epinephrine. So you need these vitamin Bs. But one specific one that has been tested and is a level B by the American Academy of Neurology and the American Headache Society is B2. So taking 400 milligrams of riboflavin a day has been shown in studies to help prevent migraines. Some of the things that has less evidence is things like feverfew, CoQ10, ginger, ginkgo. So some patients will continue to take these as prevention because it works for them, but again, less evidence in terms of prevention. I talked a little bit about the transcranial magnetic therapy in one of the previous articles mentioned by Dr. Andrew Weil. That's also a good way to mitigate some of your headaches. Good study out of the Mayo Clinic showed that 46% of patients using this transcranial magnetic therapy twice a day found that they had 50% fewer headaches. So there are some non-invasive devices that you can talk to your doctor about or your neurologist about to help you decrease the frequency of your migraines or even prevent them. So in summary, just make sure you keep a headache diary, make sure you mention your triggers to your doctor, try to eliminate things in your food, try to exercise to the level that you can, work on your coping mechanisms, work with ancillary providers to help you with your migraine headaches, and last of all, make sure you're getting a good night's sleep and only use supplements when talking to your doctor. So I hope that was helpful, and I'll see you next time.